You wake up to pee. Again. Third time tonight. Back in bed, you're still thirsty, even though you finished a glass of water an hour ago. In the morning, you notice that little cut on your finger again. It's been there longer than you expected. And later, staring at your phone, the screen suddenly looks blurry before coming back into focus. 4 completely different problems. Repeated bathroom trips, constant thirst, a stubborn cut, and changes in your vision. Most of the time, each could have many possible explanations, but sometimes they can be clues pointing toward the same thing happening inside your bloodstream. And later in this list, we'll get to one of the strangest clues of all, one that can actually appear on your skin. After you eat, carbohydrates are broken down into glucose, which enters your bloodstream. Insulin helps your body manage that glucose, allowing certain tissues to take it up, while also helping regulate how much glucose your liver releases. In diabetes, the body either doesn't make enough insulin, doesn't respond to it properly, or both. The result can be too much glucose remaining in the blood, and that can leave clues throughout the body. One of the classic clues is suddenly needing to urinate more often. Your kidneys constantly filter glucose from your blood and normally reabsorb it. But when blood glucose rises high enough, more glucose can remain in the urine. That glucose draws extra water with it, increasing how much urine your body produces. You may notice more bathroom trips during the day, or find yourself repeatedly getting out of bed at night. Of course, frequent urination has many other causes. 1 or 2 extra bathroom trips aren't specific to diabetes, but when the pattern persists, especially alongside the next clue, it's worth paying attention. Because you're losing more water through urine, your body tries to replace it. So you become thirsty. You drink. You urinate again. And yet, you're still thirsty. It can become a frustrating cycle. Pee, drink, pee again, still thirsty. Persistent excessive thirst, together with increased urination, is one of the classic patterns associated with high blood glucose. But what if you're not thirsty? What if you're simply exhausted? Fatigue is tricky because almost anything can make you tired. Poor sleep, stress, anemia, infection, medications, and dozens of other conditions. So fatigue alone tells you very little. But diabetes can disrupt normal glucose metabolism, and frequent urination can also leave you dehydrated. Together, those changes can contribute to persistent tiredness or weakness. The important word here is pattern. Fatigue alone proves almost nothing. But fatigue appearing alongside unusual thirst and frequent urination begins to tell a more interesting story. And sometimes that story comes with another paradox. You eat a full meal. A little while later, you're hungry again. There may be plenty of glucose circulating in your bloodstream, but when insulin is severely lacking, or your body's response to insulin is disrupted, normal energy regulation can break down. In more pronounced insulin deficiency, tissues may not be able to use glucose normally. The result can be increased hunger, even though you've been eating. Plenty of fuel may be circulating in the blood, yet your body's energy system isn't functioning normally. And in some people, that disruption produces an even more surprising clue. Imagine eating normally, or even feeling hungrier than usual, while the number on the scale keeps falling. When insulin is severely deficient, the body begins relying more heavily on stored fat and protein for energy. Calories can also be lost when glucose spills into the urine. The result can be unexplained weight loss. This tends to be more dramatic in type 1 diabetes, where insulin deficiency can develop rapidly, although unexplained weight loss can occur with type 2 diabetes as well. It's not something everyone with diabetes experiences, but losing weight without trying deserves medical attention, regardless of the cause. Now, the first 5 clues involve things you might already associate with blood sugar. The next ones are easier to miss because they can show up in your eyes, a tiny wound, your hands and feet, and eventually your skin. Blood glucose changes can affect fluid balance inside the eye, temporarily changing how the eye focuses light. The result? Your vision may become blurry. These glucose-related focusing changes can be temporary and may improve as blood glucose stabilizes. That's different from diabetic retinopathy, where long-term diabetes damages blood vessels in the retina. So one blurry afternoon doesn't mean diabetes or permanent eye damage. But recurring or persistent changes in vision deserve proper evaluation. Think about a small cut or sore that seems to linger longer than expected. Over time, diabetes can affect circulation, immune function, and the body's normal wound healing processes. That can make some wounds slower or more difficult to heal. This isn't necessarily one of the earliest signs of diabetes, and many other factors can delay healing. But a wound that repeatedly struggles to heal, particularly on the feet, shouldn't simply be ignored. And sometimes, poor glucose control leaves another clue: infections that keep coming back. Diabetes can alter parts of the body's immune defenses, while glucose-rich environments can also favor the growth of certain microorganisms. That can contribute to some recurrent skin, urinary, or yeast infections. But here's the important distinction. Having one infection does not mean you have diabetes. These infections are extremely common for many reasons. It's when infections keep returning, especially alongside other symptoms or diabetes risk factors, that discussing blood sugar testing with a healthcare professional may make sense. This one needs an important warning. It's not usually an early sign. Over time, persistently high blood glucose can damage peripheral nerves. Symptoms may include tingling, burning, pain, or numbness, often beginning in the feet. But don't assume tingling means diabetes. Vitamin deficiencies, nerve compression, medications, alcohol use, and many other conditions can produce similar symptoms. Persistent numbness or tingling deserves medical evaluation because figuring out the actual cause matters. And now we reach the clue we teased at the beginning. It's called acanthosis nigricans. It can appear as darker, thicker, velvety-looking skin, often around the back of the neck, armpits, or groin. Acanthosis nigricans is strongly associated with insulin resistance, which commonly underlies type 2 diabetes. But it does not prove you have diabetes. It can occur in other situations as well. If a new patch like this appears, especially alongside other risk factors for insulin resistance or diabetes, it's worth discussing with a healthcare professional. But there's something even more important than number 1. Something this entire countdown can't actually show you. Type 2 diabetes can develop gradually, and some people have few or even no obvious symptoms. They may feel perfectly normal. No constant thirst, no repeated bathroom trips, no obvious vision changes, nothing that screams, "Check your blood sugar." Some people discover it only when routine blood testing shows that their glucose has been elevated. That's why this list isn't a diagnostic checklist. You can't rule diabetes in or rule it out based only on how you feel. Most symptoms we've discussed aren't emergencies, but some situations shouldn't wait for a routine appointment. If severe thirst or urination is accompanied by repeated vomiting, severe abdominal pain, unusual or labored breathing, severe dehydration, marked drowsiness, or confusion, seek urgent medical care. Severe hyperglycemia can sometimes develop into a medical emergency,